Were you diagnosed with cancer? Oh, well, sister, then you need to watch this. I'm Dr. Amy, 6-year cancer survivor, and in this video, I'm showing exactly what you need to do now that you've been diagnosed with cancer. The things in this video, well, your doctor is not going to tell you this. Now, don't get me wrong, your oncologist, your cancer care team, they're obviously fantastic resources for you, but there are certain things that you just don't understand unless you've gone through cancer yourself. That's me, stage 3 cancer survivor. So whether you've just been diagnosed yourself or if you love someone who's struggling with a diagnosis, well, this video is a must-watch for you. This is the insider edition to being diagnosed with cancer. If I had known these things before I started my cancer treatment, it would have saved me from so many struggles, pain, and frustration. Starting with number 1, focus on what you can control. This is what should really guide your energy and your decision-making. Try to focus on what you can control versus what's out of your control. It can be frustrating and concerning that you're not able to start treatment immediately, or that you've been active and healthy your whole life, but yet you still got cancer. You've got to focus on what you just can control. This is such great advice, and that's why I love seeing that the American Cancer Society gives actually the exact same suggestion. Okay, but that brings me to the next thing that you need to do now that you've been diagnosed with cancer. And this thing isn't exactly what you should do, but more so what you should not do. Not all chemotherapy causes you to lose your hair. I've heard way too many stories of women who are diagnosed with cancer, chop all their hair off, only to find out that their treatment plan includes a type of treatment or chemo that they wouldn't have actually lost their hair. But if you are going to end up losing your hair because of cancer treatment, here's what you need to know. The hair loss is everywhere. If you end up losing your hair because of chemotherapy, then that hair loss, well, it's not just on your head. Some women lose their eyebrows, their eyelashes, their leg hair, even the hair in their bikini area. But this really varies based on the individual. For me, I lost all the hair on my head, but I kept my eyebrows and my eyelashes. Everyone is a little bit different on this one, but here is a great tip from a fellow cancer survivor. Before you start chemo, you might want to consider getting your eyebrows microbladed. This will give the technician a guideline about what your actual eyebrows look like. And so when they do fall out, if they do, then your eyebrows will still be there. Okay, but on to number 3, and this one, many women do not realize is going to happen. Your nails will change. Chemotherapy will affect your nails. They can become brittle, discolored, or misshapen. Now, some women will say that if you keep your nails painted during chemotherapy, then this is less likely to happen to you. Now, there isn't much proof that this actually works, but personally, I did keep my nails painted during chemotherapy, and I never had any problems with my nails. So take that for what it's worth. Now, the number 1 side effect that people usually think about when it comes to cancer or chemo is nausea. You may have nausea. It's definitely possible that you could have nausea or vomiting following your treatment. But keep in mind, this is much less common than what is actually portrayed in the movies or on TV. There are a variety of medications designed to control nausea and vomiting during chemotherapy. If you have symptoms of nausea, then you need to bring this up to your team. There are a bunch of different options that you could try. But here is the side effect that is far more common and highly underestimated. Exhaustion. The most common side effect of cancer and cancer treatment is actually exhaustion. Nearly 100% of women will experience this. You're left feeling fatigued and without any energy. The good news is that there's some really clear ways to actually help support your energy throughout your cancer treatment. That's exactly why I'm linking up my free recipe book below, 15 Cancer Recovery Recipes for Women. Click the link below to get it for free. This is the perfect place to start to feel re-energized and to reclaim your energy. Click the link below to get your free copy now. So once you start eating to fuel your energy and your healing, then you'll also want to focus on staying hydrated. This is so underutilized by women during their cancer treatment. You'll want to stay hydrated. This is the best way to protect your energy. The last thing to remember is that you'll want to be strategic about how you expend your energy, how you use it. Knowing that you're going through cancer treatment, you know that your body is going to be put to the test. This means that you have to focus on caring for you. You're only going to have a finite amount of energy to use every single day. So get friends or family or hire help to help you do tasks that you don't have to do. This will free you up to focus your energy on the things you love. But that brings me to the next thing that you need to know following a cancer diagnosis. Your taste, it will change. Now, a lot of people think that they will hardly be able to eat anything during their cancer treatment, but this is not true. Many women mistakenly try to eat as much as they can whenever they're able because they're never quite sure when that nausea is going to hit them. The good news is that drop in appetite or that extreme nausea, it actually never hits. The bad news is that most women actually end up gaining weight because they're overeating, thinking that in the future they're not going to be able to eat. But what does happen quite frequently is that you'll find that your taste is going to change. Foods you loved before cancer, you might not like during chemo. And foods that you never ate before cancer, you might love during chemo. But keep in mind that this is all short-lived. Your taste will eventually come back after you finish treatment. Now, of course, your taste can change, but there are other things that change too, like chemo brain or cognitive issues. Many women experience what's commonly known as chemo brain. This is often described as memory lapses, difficulty concentrating, or brain fog. A breast cancer survivor that I work with in the Cancer Freedom Program struggled a lot with brain fog during her cancer treatment. The one morning she wanted to leave her house to run some errands, but her neighbor was outside. She had lived next door to him for 13 years, but she could not remember his name. She was scared that if she went outside, she would start talking to him and then still not be able to remember his name. These types of memory lapses can happen after you're diagnosed with cancer. It's not necessarily clear as to why this is happening, but it's thought that it could be a response to the chemo treatment you receive, or it could be a type of trauma response. When you're diagnosed with cancer, so many things are happening to you all at once. By definition, trauma is anything too fast, too soon. That's cancer. That brings me to the next thing that you absolutely need to do after being diagnosed with cancer. Process your emotions. Receiving a cancer diagnosis can be extremely overwhelming and shocking. Taking time to actually express your emotions, well, that is a very important first step after being diagnosed. It's one of the tips that even the Mayo Clinic suggests doing after being diagnosed with cancer. And it's uncomfortable to sit with those emotions, anger, fear, anxiety around death, but to work through and past these emotions, you've got to sit with them. Now, having a positive attitude, well, that's helpful not only in cancer, but all areas of life. But you do not need to feel forced to stay positive all the time. Allowing yourself to occasionally feel sad or scared or anxious, this is not going to impact your treatment or your prognosis. You are allowed to feel your way through your emotions after you're diagnosed. And I will always say that 2 people saved my life, my surgeon and my therapist. If you haven't yet contacted a therapist to support you through treatment, well, now is the time. Even if you feel like you are coping and staying pretty positive, you'll still want to get that support. You'll want to start therapy early, so now is the time. That brings me to the next thing that you need to do after being diagnosed with cancer. Learn about your diagnosis. Before being diagnosed with cancer, you likely didn't know much about cancer at all. A cancer survivor that I work with said that she knew about breast cancer before she was diagnosed, obviously, but she had no idea that there was actually different types of breast cancer: triple negative, triple positive, HER2 positive. Having a better understanding of your diagnosis will give you a better sense of control over what's happening to you. If you're knowledgeable about your diagnosis, then you have a better understanding of it, you can ask better questions, and you know what to expect. Now, this next one, it's an important one that a lot of people get wrong. You can live a normal life after cancer. During cancer treatment, you can still do a lot of activities that you did before you were diagnosed with cancer. If you want to continue to work during your cancer treatment, well, that's possible for a lot of women who are diagnosed with cancer. Okay, but here is what you absolutely cannot miss. You need to do this next one. Exercise during your cancer treatment. So many women completely stop exercising after they're diagnosed with cancer. But this is wrong, completely wrong. Exercise can help with so many things during cancer treatment. It can give you more energy. It can help with joint pain. It can lower your hot flashes. Now, many women avoid exercise altogether because they believe that it needs to be really intense. But this is wrong, absolutely wrong. Instead, try taking short walks or do a yoga routine. Keep this up during your treatment. It will help with so many side effects. Okay, but that leads me to the last thing that you need to know after being diagnosed with cancer. The period after being diagnosed, but before starting your treatment, well, this is the most stressful time during your cancer experience. When I think back to my own personal diagnosis, this was the most stressful period. The period between knowing you have cancer and starting your treatment, it's awful. You obviously want to do something, anything to get the cancer out of you. So you want to start your treatment as soon as possible, but you obviously need to wait. It takes time to get scheduled into treatment or booked into an OR time to have your surgery. And in the meantime, it's really difficult. I can understand that firsthand. But here is something you can get started with right now to help keep yourself strong during cancer treatment and recovery. Knowledge is everything. You want to make sure that you're informed. That's exactly why I'm linking up this next video here on chemo secrets. Click the link here. I'll see you in the next video.